Good afternoon, everybody. Welcome to our briefing that we are doing on Mondays. We appreciate you continuing to join us to learn what's happening with COVID-19 in the Eau Claire area, getting some questions answered, and being reminded of where to get more information. Thanks for joining us. It is July 6th. I hope everybody had some chance over the weekend to have a little break with the holiday happening, the 4th of July holiday. I hope you found ways to get together with family and friends in safe ways, both because of fireworks and because of COVID-19. Doing that safely was something that was important, so I hope that happened for everyone. I know I enjoyed having my family together to be able to celebrate. So we will, as usual, start with some state and local data. Luke Feedy is here from the Department of Human Services to share a little bit of a mental health update again. We are happy to have him join us. And then I'll close and we'll have time for questions. So to start, our state status update. Negative test results are at 588,913. An increase of 4,802 since Sunday. Positive cases are at 32,061, an increase of positive cases for COVID-19 of 484 since yesterday. The number of deaths, the number of people in Wisconsin that have died of COVID-related illness are at 796. Almost 800 people in our state have died. And hospitalized, we are now at 3,602 of our positive cases of COVID-19 have been hospitalized. In Eau Claire, we are at 8,629 negative test results, an increase of a progressive number of positive of test results over that time. So 77 came back on Sunday as negative, and 211 came back as negative on Friday. Our positive test results are at 290, an increase of 6 over the weekend, including 27 additional on Friday. Of those 290 cases, recovered are 183 as of the 5th of July. Again, that data is tabulated weekly, tabulated at a state level and is available as the state updates that. Our cases are distributed about the same as previously. That data is available on our website, the COVID-19eauclaire.org website. Fairly equal distribution by sex, and our age group, again, that young adult age group, 20 to 29-year-olds, are our largest number of cases in Eau Claire. That is fairly similar to what we're seeing across the state. A couple of additional pieces of information. Over the weekend, Wisconsin experienced the highest positivity rate yet for COVID-19 from testing since the beginning of May. In nearly 2 months, we are now starting, in fact, the last 3 days. The state positivity rate has been the highest we've seen in a long time, 10.8%, 10.4%, and 9.2% the last 3 days. This is, in fact, with significantly fewer tests the last 3 days than a week ago. So it's certainly not a case that less testing meant less cases. It is really that we are seeing more disease. So that's happening at a state level. That's also happening in Eau Claire. Recent data in Eau Claire and the recent significant rise in cases in Eau Claire is showing that we are not immune to the rapid spread of disease. We knew from the start that this was a disease that spread rapidly, and we are starting to see that now as people's circles widen, as they are out more in the community, we are seeing the disease spread. Again, we're not surprised by that. Our continued method of slowing down this disease is to keep physical distance, stay home when you're sick, and wear a mask. While those statements may seem like old statements, they really, in the end, make a difference. It's what we're seeing in the cases in Eau Claire, and it's what we're seeing across the nation. Our 7-day positivity rate has been between 15 and 25% in Eau Claire since the beginning of July. Again, we'll do our running 14-day averages for our measures, but do know that the last few days, our positivity rates in this community have been very high. It's really going to take all of us to do something about this. It's time now to slow down the spread of disease, and we really need to count on one another. We are having a lot of community conversation about wearing a mask. It is not a political statement to wear a mask. It's about protecting one another. It's about me protecting you and you protecting me when we are out in public spaces. I really encourage you to look for those places out in public and go to those places out in public that are giving you a clear signal that mask wearing is an expectation, that they expect to protect their employees and they expect to protect you as a customer by making sure masks are worn. It does make a difference if we really start counting on one another to have that happen. We also continue to encourage people to keep their circles small. We are seeing in social settings disease spread happening because people are choosing not to keep their social group small. The larger the group that you interact closely with, the more chance you have of getting disease. It is something that may have very low symptoms for some people. They may be out in public, and if you are in touch with them, you are in touch with every other person they have been in close contact with. So again, we count on businesses encouraging this. We count on you in your social circles including this, encouraging this, and it will make a difference if we all encourage our circles to stay smaller and we encourage masks to be worn. We have also, over the weekend, been notified that there may be some individuals in the Eau Claire area doing some scamming of people, pretending that they are contacting them because of contact tracing needs. Again, contact tracing is when someone gets a phone call from the health department staff that says you've been a contact to a COVID positive case. The reason that you get that phone call is that you are at risk, if you were a close contact, of also having the disease spread to you and spreading it unknowingly to others. The more that we can do good contact tracing and keep those close contacts home until we know that they are not positive, that 14-day window, the better we'll have in stopping the spread of disease. These scams are contacting people and asking for information that we would never be asking you for. So it is not a health department employee if they are asking for your social security number. It is not a health department employee if they are asking for personally identifying information like bank accounts and those kinds of things. We will be verifying with you that you are a contact to a case, and we will be asking you some information in order to maintain that contact in our system. If you ever have a question about a phone number that comes to you, someone leaving a message, and you're not certain if it's the health department, please immediately look up our number on the website or through a form of information that you can count on to know that you're getting to the health department, and ask for information about whether you are being contacted by one of our employees, and we're happy to talk to you about that. Again, you can also call our COVID call center number at 715-831-7425. So again, nobody from our contact tracing team will call and ask you about your social security number, bank information, credit card information, or any other personal information like that. We will ask you about your symptoms. We will talk to you about what your address is and to stay home. But other than that, you really want to make sure that you are talking to a health department employee. If you are someone that does get a call from someone that is asking for information like that and is clearly a scam, please contact the police department or the health department, and we will forward that to the police department. So now I will turn it over to Luke Feedy. He is sharing some information with all of us about staying healthy during COVID-19, and will be giving us his thoughts. Thank you, Luke.
Thank you, Liska. So with Pride Month ending and the Black Lives Matter movement, many of us have asked ourselves how we can continue to support our fellow humans, particularly those who come from marginalized populations. One way is to identify yourself as an ally. An ally is someone who supports people and equality in its many forms, both publicly as well as privately. Heterosexual, white, able-bodied individuals can be allies, as can people of color and those within the LGBTQIA community, as well as individuals with disabilities. Allies support one another's unique needs and struggles. Here are some aspects, some important aspects of being an ally. 1, continue to learn about the unique experiences of those who are in the LGBTQIA community, about those who are people of color, or those with disabilities. Listen to their experiences and recognize how they are different than your own. Our reality is often shaped by our own experiences, and until we hear about someone else's experience, we don't have the opportunities to really challenge our own reality and learn. 2, unlearn historical or harmful historical messaging. We as human beings often learn from stories. Some stories often portray people or persons as dangerous or as evil. And when we unpack our stereotypes and unpack some of that bias that we carry with us, we understand more clearly what our biases are, why we have those stereotypes, and then can work harder to mitigate them. Understand why they're a barrier for us to learning about other people's experiences. Number 3, learn and use inclusive language. Language is important. The words we use have an impact on the people we speak to or with. Using language that is exclusive can perpetuate those biases and those stereotypes. Inclusive language acknowledges diversity. It conveys respect to all people and is sensitive to the differences and promotes equal opportunities for everyone. 4th, maybe the hardest of all, speak up and intervene. If you see or hear something that is hurtful or harmful, whether it's intentional or not, say something. Take time to educate those around you and show that discriminatory language or hurtful language will not be tolerated in your presence. These are some simple ways that we can identify ourselves as allies. These are not the only tools that you can use, but are a brief few. And as we work to support one another in our communities, we are healthier and stronger together. Thank you.
Thank you, Luke. I think there's lots of ways that we need to work on being healthy in this community, and certainly that is an additional one. So a couple of added points for everybody. Please stay tuned to our website. That is a place where we get updated information to you in a quick and easy form. There are a number of tabs on that website that share information about all kinds of topics, and we really encourage you to explore that for more information. That website is covid19eauclaire.org. The call center remains available Monday through Friday. That number is 715-831-7425. And we'll be back on Wednesday to talk more about recent data and to answer questions that are submitted in advance, as well as ones that come in that day. We stream on Wednesdays on Facebook Live. So today, any questions? Yes.
Lisa, given the recent surge here, has there been a stress yet on local hospitals?
Yeah, so the question related to our recent surge in cases, has there been a stress on local hospitals? We will be looking at those metrics again as part of what we do on Tuesdays, but at this point in time, we are not hearing from hospitals that there is a stress in their systems with COVID-19 related illnesses. And our goal is to keep it that way. The more that we can have the spread be slow and the more we can keep spread of disease away from vulnerable populations that are particularly at risk of severe impact of the disease, the better we'll be with our hospitalization capacity. And that's really our goal. Yes.
In that same vein, with the recent surge, are you seeing any impacts on counties, contact tracing operations? Is this frustrating for you guys?
Sure. So similar question related to public health capacity. So we're certainly following both healthcare capacity and public health capacity. The measures last week, Wednesday, were concerning already related to our public health capacity. We were already getting pushed with the quickness that we could get to contacts and the quickness that we could get to our cases, as well as the number of contacts per case that we were seeing. We will be looking at that data very closely again tomorrow, posting it on Wednesday. We also have done considerable work building our capacity. So we do have new people on board that are doing our case investigation and our contact work. That is new people needed because we haven't had to respond in this way to a disease of this magnitude in a long time. So we are building that capacity, and that group has had a lot of experience this last 2 weeks with all of the new cases we have, unfortunately. But they are learning, and that is going to be increasing our ability to respond. Yes.
Again, given the recent surge, I know a couple of communities across Wisconsin are closing taverns, talking about reclosing things. I know that that's something we obviously want to avoid, and there's been the plan. The chamber and local businesses here to try and do this safely.
Mm-hmm.
Has there been any talk or thought on your part about might we have to do that if this surge keeps blowing up?
Sure. So the question is related to the surge that we're seeing now, other communities across the state and outside of our state. We've definitely seen a need to respond in a way that is really pulling back on some of the opening that's happening. And the question really is related to how would that work here? So we do have our plan online that we have progressively been walking forward with. That plan does indicate that based on the data, as we see it every week or two, that we really evaluate the need to stay steady with our order and our practices to move forward if things are looking like we are holding in an okay position, or move backwards. So we will certainly be looking at that again this week. Our interest is really to try and focus as carefully as possible on places where we are seeing spread and try, like other communities are, at making sure that we improve the practices there and potentially do things that will slow the spread in those situations. So those are items that are under discussion now, and at this point we are meeting the need generally. What we can't see is an increased spike, and that's really where we need to, at this point, start holding steady with the number of cases per day and with our positivity rate. We will be looking at the order. The current order is expiring on Wednesday at midnight, and we will be making a decision about the subsequent order that will be coming starting Thursday at 12:01. Yes.
Related to that, Lisa, and this is probably too nitpicky, but is there a sense of how big of a spike you need to see for something might get reclosed, or there be more limits put in place?
So the question is really related to how bad does it have to get before we start doing some additional things with the order specifically. In our plan, the metrics really show that if we are all red in one of the areas, so we have various groupings, disease, public health capacity, and healthcare capacity, that we really do pause and make a decision about what happens if we need to go backwards or not. Certainly as public health capacity and healthcare capacity get impacted, we will definitely have to make some decisions to go in a different direction. We do know that disease will continue to happen. It's really how quickly it happens that is our primary challenge right now. And that's not true just for Eau Claire, that's across the U.S. The quicker disease happens, again, it's exponential because as the contact number of each one of us increases, the chance of exponentially spreading this disease is just greater and greater and greater every day. That's why we need people to keep their circle small, keep physical distance at 6 feet, and wear a mask. We will be exploring that when and if we need to. Right now, our order does require in all public spaces that 6-foot distance. If we could make sure that all of our public spaces keep 6 feet distance, we would go leaps and bounds above every other community in controlling this disease. So what we all need to expect is that if we minimally follow the order, the 6 feet distance, we will be in a good spot. The places that are not doing that, the individuals that in their private social settings are not doing that, that's where we'll continue to see spread of disease. Yes?
Some local criminal justice activists and a county board member sent a letter to Health and County officials calling for mass COVID-19 testing in the Eau Claire County Jail. Specifically, they pointed out in the Eau Claire County Jail got most cases of COVID-19, they tested everyone. Why hasn't the Eau Claire County Jail done that, and can you talk about the health department's role in that?
Sure. So the question is related to testing in the Eau Claire County Jail. There's been communication that an ask for testing to happen in the jail, using an example in Trempealeau County where there was one case in Trempealeau County, and Trempealeau County Jail inmates and staff were tested at that point in time. Eau Claire Health Department and the Eau Claire County Jail have been working carefully together to monitor cases that are present in the jail. Like we do in every setting, we do recommend testing of anybody that is a close contact and at risk for having COVID-19. Because of practice differences in different jails, the practices in the Trempealeau County Jail and other places meant that more widespread testing needed to happen. In our jail, where we've had someone come into the jail that ended up testing positive, all the appropriate practices were in place to make sure that there were no close contacts to anybody that didn't have the right protective equipment on, which meant that spread didn't happen. It's really our goal to have those practices in place so that we don't have to do widespread outbreak testing in a setting like the jail. We are also working with the jail on exploring next steps related to testing, as the state has last week released a report about asymptomatic testing in congregate care settings. So that includes shelters, jails, group homes, assisted living facilities, places that we haven't done and haven't recommended asymptomatic testing of staff or residents. The state is now encouraging all communities to start looking at that as a possible way to look at disease spread once there is widespread community spread of disease. So we are similar to all communities now as of last week's update from the state, starting to explore that with our testing group. Not particular because there's an issue in the jail, but because it's one of our many congregate settings that we are looking at. Right now, doing one-time testing in the jail of inmates and of staff really doesn't tell us much. It's really, if we're doing asymptomatic testing, has to be regularly looking at testing. Anybody that's symptomatic in the jail, both residents, both the inmates and the staff, are being tested if they are symptomatic. They have very strict protocols in place to make sure that symptomatic employees are not working and are sent home and tested. And the same with anybody in the jail that is there that is symptomatic. And that has been the long-standing state protocol, and they are following that. Yes?
If you guys were to do full-on testing, is there capacity here to do that?
So the question related to the jail, I assume, is the question. So the question... Yeah, so the question related to capacity for congregate setting testing, it is certainly a considerable issue that we are all exploring across the state. It is part of the work that the state's been doing for the last month to identify testing supplies, testing labs, making sure that as we start leaning in more to the high-risk testing that can and should happen, that we're able to do that. So there's no sense in telling any congregate setting that they should be testing every 2 weeks if we don't have the capacity in the state to do that. So we're nearing that now. We're exploring ways to make that happen, but certainly the balance between having the right people tested at the right time with the right resources is really a mixture of inputs that we are working through right now collaboratively across the community. We again are really fortunate that we have partners in this community that are interested and willing in helping with that. Next week we have a meeting with many of those partners again to talk about testing strategy, and I'm sure that as we step forward, we're starting to see long-term care facility testing more regularly now, and I think you all know that. That's one of our high-risk settings. And as we start exploring other settings and other important places that we are regularly checking for disease spread, capacity eventually may become an issue, so we have to prioritize. Yeah. So the question again related to the jail is related to any cases in the jail and whether we have new cases there. It is my understanding that we still have the same number since reporting last week of the 5 cases that have been in the jail, and we can certainly verify that. But again, those were all individuals that did not have close contacts across the jail population as a whole. They were quarantined and then isolated immediately once they had a positive test, and all the appropriate personal protective equipment was worn by the staff in those situations. So again, it becomes really important when we look at disease spread in whatever setting it might be that the fewer close contacts and the more that individual was in a situation that the right PPE was worn. This might be in a healthcare setting, a long-term care facility, or in the jail. In all of those situations, as long as the right equipment was worn in the right situations, the disease spread really can't happen in the same way as if we don't have those things in place. So that's really our long-term goal, is to do it right from the beginning. Any additional questions? Again, thank you very much for joining us today. We'll be back on Wednesday, Facebook live streaming, and certainly look forward to questions and conversation then. And until then, really think about the role you play in making sure that our community can stay as safe as possible, making those choices to keep your group small, to wear a face mask when you're out in public situations, and to keep distance, to keep that 6 feet. Even though it's hard, it's the way that we'll get our community back up and running more quickly and keep it running in a way that all of us want that to happen. Thanks very much, and we'll see you on Wednesday.